guide those hips back. There you go. Okay. And then we bring the chair so that this is facing the other way.
Yeah, facing him.
Facing him. Okay. And as you are helping him, so you might want to bring your knees up to his hips so that you could help here.
Okay. Oh, like this.
Yes.
Okay.
You see how that helps?
Oh.
Okay, Rex, do you want the chair a little closer? So sometimes, so Alex is staying in a position where she's helping to, maintain it, right? So she is giving some pressure through her knees, and then she can counter pressure at the shoulders to keep him upright. Now, if she maintains that, and this is your patient, we want them to learn to activate, right? So we don't want to keep giving them and just holding them in the position. But you know where your counter pressure is, so if he starts to go,
Okay.
you bring it.
Okay.
Okay.
So can I let off?
Let off that little bit, yeah. Let's see. Okay. What do you feel?
I feel it on the left a lot more. Like he's giving in a little bit on the left more than the right. My right is like off completely. So keep going.
There you go.
There you go.
Sometimes you could give a little, you know how we were facilitating our patient the other day? She could facilitate a little with her knee too. You know, kick it in, tighten up. Okay. And then if he needs a break, he can lean down on the chair. Okay, and he's pretty stable right there, right? Mike, what else would you have him do?
We've been trying to take hands away. We hadn't quite gotten there, but we're taking one hand away and slowly trying to off-weight the hands.
Okay.
Like I know he said, well, your goal was to get to where you can like let go of the walker and reach for stuff and standing, right? Right. Okay.
So do you see how this could be a step towards that goal?
Oh, yes, definitely.
Right? One joint that we don't have to worry about. We don't have to worry about the ankle, the knee flexing. He's the weight bearing. Just have to worry about his hips. All right. Do we want to give him a wider base to practice that?
Yes.
So if you make your leg roll.
So are we training him to kind of hang on his Y ligament and stack his?
Yeah, Alex, you can help him. You see that he wants to.
You got it? You want to shift to the right? There we go.
So, say your question again, Caitlin.
Are we encouraging him to hang on his Y ligament? So that way when he is in standing and he has his prosthesis, that they will come into place?
So my question is to Mike. Does he have any hip extension?
Yes, but a lot of it's still more compensated. So there's a lot more hanging than there is like with that stability, but I've still been trying to work on it just because of the core. And so just because it's a lot more of that, you need a lot more core to get off the wide ligaments. I'm not quite there yet.
So that kind of goes back to Evie's question the other day, where saying we wouldn't normally teach people to walk and to have that excess movement. So you have to make that determination. Is the activity, does he need a compensation? And yeah, he needs a compensation right now, but they're still working on other exercises to try to strengthen. So it'd be both. Okay. All right. You rest a minute. You're like, you talk too much. All right, and let's see then you trying to, so he's having to find his balance, use his core, tuck everything in, then you can activate and try to let loose help. And Alex is there. Have your hands kind of just there you go.
Alex is like, am I here? I don't know.
Okay, so that's one-handed, very nice, and he's alternating. You can see that Rex is focused. Could we have them reaching for a target or an object?
In my clinic, I was doing it and he reached for my hand.
Okay, do you want to give a high five? How could we progress this? Because right now he's reaching
Reaching to the sides.
crossing. Does that take a lot more?
Mhm.
Oh, definitely.
Or even make
Further out.
taking a ball and putting it from one hand to the other and
Oh yeah, that would be yeah, that's good.
like an object.
Because you can't hold it while you're you can't hold the chair while you're
Roll
transferring
over.
that.
Oh.
Yeah.
Now, we have to be able to read our patients too, to know when they need a break. Yeah, let them take a break, and you can even let them, yeah.
Would it be,
What if it's just you and them? What would be something that you could use in the clinic to make sure you're maintaining that facial,
Mirror.
mirror? This would be a good
Mirror.
time to put a mirror in front, right, so that you could talk to them and make eye contact.
He can see you.
would it be like more